And today, our guest discussing for today, she is from the Internal Medicine Department at the GFK Medical Center, and her name is Dr. Flinway Dixon. She is from the Internal Medicine Department. She will introduce herself properly when we go to her. But we want to invite you again to come, invite someone to listen to the program, and later on, we're going to open the phone lines where you can call and ask the doc based on what she has discussed, about information that you need to know. And so today we'll be discussing the topic, everything that has to do with dialysis. And as you are all aware, some of you hear about dialysis. What is dialysis? We're going to be knowing today from our doctor, Dr. Dacing. And for the sake of time, we would like to go quickly to her to introduce herself in terms of what she do at the GFK Medical Center or position. Good afternoon, Dr. Dixon, and welcome to the program Inside JFK. Doc.
Good afternoon, Mr. Creighton, and thank you for having me on this program.
Okay, great. Sorry. These people will not stop calling me. Okay, yeah. So, Doc, can you please introduce yourself? What is your work? What work do you do at the GFK Medical Center?
So, like you rightly said, I'm Dr. Flinway Dixon.
Okay.
I'm a specialist at the a specialist in internal medicine. That is, I'm an internist.
Okay.
And I work at the medical department at the GFK Memorial Hospital.
Okay.
So usually I see general medical cases, but specifically I am basically over the dialysis center, the Eddie Johnson Sirleaf Dialysis Center at GFK. So
Okay.
yeah.
Wow. I can, from your introduction, what you have said, I can see that you have a very huge tax because the EJS dialysis center that was dedicated I think a year ago by the government of Liberia. You see sometimes the influx of patients at that place, at that facility now, and then it would make you to realize that actually people needed these services, but the facility was not available at the time. So, but let's just discuss a bit about patient inflow at the facility there, and all of that before we go into our discussion. There, tell me how has it been? Like I think 1 year or so, the facility was established, and you are there, providing your expertise and your service. How has it been?
Yeah. So I mean, with the establishment of the dialysis center, I mean, we have been doing some amazing job there. So back then, like you said, some 2-3 years ago, we didn't have the capacity to do dialysis, especially, and the purpose of dialysis is actually meant for patients who kidneys have failed and the kidney is not functioning well. The kidneys are not functioning well, so dialysis served that purpose. So, like I said, 2-3 years back, 2 years, and
That facility was
back
not
where
yet, so
we
you
didn't
couldn't
have
do
it. So
that. People had to
yeah,
travel.
our people had to travel.
travel
So
the country.
it was there was a lot of stress, especially when it comes to the finances and the quality of care. But at least with the establishment of the dialysis center, I think we are doing an amazing job there.
That's great. That's great. And thank you for your service, Dr. Dacing. You guys do a lot of work there. Like people would say, in the medical field, sometimes the work that you do, people will not acknowledge it. But then when something goes wrong, that's the time they try to, bash at the doctors and all of that. But you don't know the kind of sacrifices these doctors make on a daily basis. So thank you for your service at the JFK Medical Center, Dr. Dacing. Straight into our topic for today, dialysis. Someone out there, they have been hearing about this dialysis. Or someone want to know what is dialysis, Doc? Begin with that.
So dialysis, simply put, is a procedure where is a process in which you remove waste. So the toxin, so you remove waste and excess water from in someone whose kidneys are not working. So in other words, the dialysis machine serve as a substitute or artificial kidney for patients whose kidneys are not working.
Okay. So if I got the definition properly, can you describe the situation? Like maybe someone who has a kidney failure. So how does this person look in terms of physical appearance? Because more often, yeah, we see people, walking and somebody say that the person got kidney failure, even though they are not doing the person test to know though. So yeah, so how can the person look? Someone who actually has a kidney has a disease.
Okay, before you come to a disease of an organ, you should first understand the function of the organ, because when the organ is malfunctioning, that is when the symptoms develop.
Okay.
So usually the kidney major job is to eliminate waste and toxins. So all those waste in our blood, we eat food, we inhale some toxic things, we ingest urine medication, all of things. So the kidney job is, as the body process most of the thing, take up the good nutrients. So the waste material is dumped back in the blood, and the kidneys are there to get it out of our system.
Flush
Because
it
if
out.
the kidneys do not get it out, it becomes a problem for us to develop the symptoms. And also, the kidney too try to maintain balance. So water. So you realize that if you're not drinking too much, what you do, you will not urinate, because the kidney try to reserve.
Okay.
So it keeps the balance. So wherein you are drinking a lot on a normal day, and you tend to urinate, it tells you that the water you are passing out is excess. The body does not need it. So it maintains that equilibrium. And it also plays a part in maintaining our blood.
Okay.
So usually, as a result now, we all know the function. So when the kidneys are malfunctioning, so obviously you know that there will be a lot of toxin. So it is the toxin that build up in the blood that create the symptoms. And the kidney, like I said, is supposed to keep the water balanced.
Yeah.
So some of the symptoms you will start experiencing is you will start retaining water or fluid. So the face will get puffy, the legs will start swelling. You tend to have other symptoms, like for your gastrointestinal tract, or where you eat, you tend to have this nausea, you vomit a lot. Some people develop persistent hiccups. And one other thing, usually sometimes it is the early symptoms when kidney damage is a pressure. People pressure tend to go high. So especially in a younger age group. So you go to the hospital, all of a sudden they tell you, oh, your pressure is high. So that's the reason why everybody that works in the OPD, the outpatient department, with elevated blood pressure, you first check the kidney to see if it is not the kidneys. So those are the symptoms. So swelling, you have flank and pain on the back, and you will vomit. And worst case scenario, depending on the severity of the damage, you will not even urinate. You will not even produce urine. So those are all the symptoms as regard to when kidneys are not working.
So is it good to practice the tendency of drinking sufficient water?
Yes.
Just from what you explained.
So a lot of things damage our kidneys. So like you said, not hydrating yourself, especially we who live in this humid weather where we sweat a lot. You know, the hot weather, you lose a lot of water. So we need to balance the water. So you need to hydrate, because like I said, the kidney function with water.
Yeah, sure.
So blood has the blood cells and water. So you need, so hydration, people not drinking well, alcohol, doing illicit drugs, smoking,
excessive alcohol intake.
Excessive alcohol, drugs intake, and even the medications we use around here, the commonest thing, the painkillers, the brufen, the diclofenac. Sometimes they come in the form of Pingo, this, all kinds of funny names. So and most of our people, they buy this drug over the counter and they don't know
without
prescription, and they over abuse this drug, and it tend to have an impact on the kidneys.
Thank you. So folks in Riddleland, if you are just tuning in, this is a reminder that you are tuned to the program Inside JFK, #1 health program on ELBC. And this program comes away every Monday from 1:05 to 1:45 p.m. On this program, we bring you the experts, we bring you the specialists, and doctors from the JFK Medical Center to come and explain to you those health related topics, things that are affecting you in your community, your body, your health, the overall general health, benefits and all of that. So today we have with us Dr. Flenway Dixon. She's an internist from the internal medicine department at the JFK Medical Center, and she is discussing the process of dialysis and kidney management. So, Dr. Dixon, so what is the benefit of dialysis?
Okay, so dialysis, because the whole idea of people seeking care when they are ill is you want to prolong your life.
Okay.
You're not ready to die.
Certainly.
Yeah. So when it comes to kidney, dialysis is a life-saving treatment in that it does the work for the kidney. And at the end of the day, the benefit it gives you, like, it improves your quality of life, such that if you were working, you can be able to go back to work.
Yeah.
If you were in school, you can go back to school. You can be able to drive, move around, do your normal daily activities. So it tends to improve your quality of life by thereby helping with the kidney function.
Okay. So what are the types of dialysis that you conduct, especially maybe at the JFK Medical Center, where we now have a dialysis center?
Okay, with the type, generally there are two types. You have the hemodialysis. So that one, you have the tube going directly in the person's vein, so into the blood. Okay, then you have the peritoneum. That one, you have the tube going into the person's stomach.
Wow.
So those are the two ways.
So at what stage do you let's say come up with like which step of at which stage do they have different stages of which you apply these
No,
methods?
it's just the option. Usually in the children, the pediatric, they prefer the peritoneum, the one you use the stomach.
Okay.
Yeah, is with that people can move around and do so. It's easy. So usually that is more preferred for the children. But for the adults, usually, and the one we have there is actually the hemodialysis.
Okay, hemodialysis.
So that one, yeah, your blood leave your body, goes through the machine, and the machine filters the blood and return the blood back to the patient.
Wow.
Yeah.
This is this process is not a small process, Doc, because where you are maybe will you be unconscious? Is the patient usually unconscious or what? Because all the blood leaving the body and all of that, is the patient conscious? Will they be
conscious? The patient is very conscious. The patient can be having conversation. So this is how it works. So your blood is in circulation.
Yeah.
Right? So your heart pump blood, the blood goes around in circulation, it returns to the heart. So it just in circulation. So the dialysis, if you see the machine, how it's structured, it is like that in that circulation form.
Yeah, I just wanted you to give the picture, the vivid picture, because I've been there, I've seen it, but for our folks in Riddling, so just to understand.
The machine is just like a chair. So you sit in the chair, but first thing, the requirement is you must have an access.
Okay.
Yeah.
Yeah.
So like you're going to take drip. So it's like this. You're going to take drip.
Yeah.
The drip, they can connect the drip bottle to the tubing. But that tubing can't go in. So you need to use the cannula, that pointed needle.
Yeah, sure.
And they put it in your vein, right?
Okay.
And they connect the drip tubing to it. And you receive the drip, or they can even put medicine. Okay. So for the dialysis you have to have an access to connect you on the machine. So the access can be two forms. They got a surgical form, and they got the central line where we have the catheter. So those are big tubes that will go into one of the big veins. So either will go through the thigh or will go through the neck, the jugular.
Okay.
So two ways. So we have the big tubes that we connect those tubes. So it is that once the tubes are inserted, then we connect the dialysis own tube to that catheter. And the catheter can remain in, the patient go around, know that they even have something on it. So yeah, it can be secure. We leave it in, they move around and be coming regularly for the section.
Wow.
Yeah. So for the surgery they call it the arteriovenous fistula, the AV fistula.
Okay.
So that one, what they do, the surgeon will do that, they will take your vein it's a surgical procedure where they take the veins and the arteries. So those are two different blood vessels. One return blood to the heart, one take blood away from the heart. So they connect it. They do also connect it. So when it's connected, then you can pass the needle in it and connect the person to the machine. But the difference between them is this. The surgical procedure, once you do the surgery, you cannot use it immediately. It takes 2 to 3 months, sometimes longer, because it has to mature. In other words, it has to heal and mature. So if you need dialysis urgently, it means you still need to use the central line access. So that is that. But then the advantage is the surgical procedure, the AV fistula, lasts longer. So it can be on the patient for years. You can even travel anywhere. Once you go in another country, you got a machine. So the catheter, we have two forms: the femoral, the one that goes to the thigh, and we have the turner, which is more permanent. So those are the ones. So you must have an access before you get connected. With the access now, anytime you can just walk in, sit on the machine, and you connect the tube, and your blood circulate. You see your blood going in, but it will be returning to you. So it doesn't just cut off your blood totally.
Well, folks, today we are having another very educative discussion here today on the program Inside JFK. Like I said earlier, you can invite someone to listen to the program. And we have our doctor here with us, Dr. Dixon from the JFK Medical Center. And she is explaining the process of dialysis in terms of kidney management. And so we will open the lines as we go further so that you can call in to ask some questions relative to what Dr. Dixon has already deliberated on. So, Dr. Dixon, back to you. So does dialysis cure the kidney disease? Because I understand that you have kidney diseases and things. I think it is at a stage where the kidneys fail. That's when I think the dialysis come in also. Or when you have the kidney disease, just go ahead, because let me not jump the gun.
The answer is yes and no. If dialysis cure kidney disease. So that when the kidney disease, so there are two forms of injury pattern. I mean damage to the kidney. The acute, that means if the insult was abrupt, abrupt insult to the kidney.
What do you mean when you say abrupt insult?
Abrupt in the sense that probably you got exposed, maybe some kind of infection or or probably some kind of toxin. Usually for the acute form is most likely infection. Infection that is overwhelming in the body and some like the pregnant women, massive blood loss.
During pregnancy.
During pregnancy, you bleed and lose a lot of blood. It can make the kidney to shut down. So heavy bleeding, and infection, especially chronic overwhelming infection and toxin. So that is either taking
on waste,
I mean toxin in the sense that thing you put in your system. The medication you're doing overdose, drug overdose, whatever. So those ones are the major ones that tend to abruptly
shut down the kidney
and cause injury. So injury to the kidney does not translate to failure. So we
the kidney can be injured, but it can feel like shut down.
So in other words, the kidney has millions. Both kidney we have billions of cells. So in a sense that the insult to the kidney was too abrupt, there is no time for the kidney to recover, so it shuts down. So in an instant, once the patient gets the dialysis immediately, it's life-saving. So depending on the number of sections, they can improve and they will not need dialysis again. So that is for acute kidney injury. That is when the insult is abrupt.
So you talk about the depending on the session. So that means it is not just once and then you go. You have to do continuously.
So we have sections. So depending on the patient, we can tell you say come and do it 3 times. So different. But the issue here is to know, because that is most of our patients usually those are the questions they ask, whether I will remain on dialysis forever. So I'm trying to say dialysis cures kidney problem in a sense that if the insult is abrupt, it can be reversed. But when the damage to the kidney is chronic, that means it's been there all years.
Wow. And you are not ready to
Yeah, you don't know. And those form, the symptom is non-specific. Usually people will just feel weak. So they will not come with that abrupt swelling. When you see them swelling, that means they're in end stage. So that means the kidney damage has been gradual, because the thing about it, the cells damage. So like 10% of the cell damage, the 80% will compensate.
Exactly.
So you don't feel the symptoms.
Okay.
So you go as when 50% of the kidney cells are damaged, then you start developing symptoms because if they half cannot do their work, and fully do the other half.
So it's communicating to your body and that there's a problem. Yeah.
So those who kidney damage have been there for a been gradual and for a long time. When you see them with a swelling and this now, and they require dialysis, for them, dialysis is not a cure. Dialysis is just a bridge. That is something that you need to be doing. Because the definite treatment for them is kidney transplant to get new kidney. So in the absence of damage, so your kidney damaged completely. So that is we call it chronic kidney disease. So when you reach to stage 5, you in failure. So it's irreversible.
So even if you apply the dialysis now, you can't help the
so
patient.
The damage is irreversible. So it's structurally, all your kidney cells are then damaged. You cannot revive the damaged cells. So those patients with chronic kidney disease, by the time you hear the word chronic kidney disease and the patient now qualify for dialysis, that's a lifetime treatment that person will be on.
Wow.
Yeah. So it means to say you don't have kidneys. The machine is your kidney. And you know kidney is supposed to do it well every day now.
Yeah, so then that means you have to be, they're going to schedule you to be coming there.
To be coming for your treatment until you get transplant.
Okay. So is there an instance where maybe one side, one of the kidneys is damaged, one of the kidneys is damaged, then you can use the other one and live on it?
Yeah.
Okay.
So usually when you see people having symptoms of kidney problem are both kidneys.
Okay.
So one kidney can do the work for both kidney. Yeah.
So one can have a problem and you will still be surviving and you will not have any symptoms? So
technically people who go for kidney transplant, they only get one kidney.
Oh,
they do not give one kidney and both of them. So it means they live on one kidney.
Oh,
so it tells you that,
okay.
Yeah. So it tells you that one kidney you can live on one kidney.
Okay.
Yeah.
Okay. Yeah, because these are some of the things that people, when you listen to people in the public, they just say some of those things, and then when you want some clarity, you need to ask a professional, to know and and inform the public. So, folks in Radio Land, like we have said, we are here today again on the program Inside JFK, and we are discussing dialysis and kidney management or kidney health. And we have Dr. Dixon with us. Yeah, I said just keep posted. We will announce the numbers that you can call in to participate on the program and put in your concerns or your suggestion or ask your questions relative to the topic. So Dr. Dixon, so what are the requirements for starting a dialysis? I think we discussed. We went over it. So you might have you might have an access and then from that. Okay.
Either the catheter or the AV fistula.
Okay. So where can dialysis be done?
Yeah. So they got in-center dialysis that is in a hospital.
Okay.
And you can do dialysis at home. Yeah.
Okay.
So, like in the developed
we can
country,
provide in the developed
I'm
countries.
saying it can be done, but it is cost intensive.
Yeah, it cost intensive.
Yeah, because you need a whole setup.
For our
in developed country, you have people doing home service. The nurse come there. They got dialysis nurse that go there and just connect them to the machine. Yeah, at home.
Okay.
So during the day, they move around, do the normal business. Whereas you got it in the in-center that is in a hospital.
Okay.
Which is what we do here.
Okay. So how long can someone do dialysis? How long?
So there is no specific duration to say, oh, you need to do dialysis for one-time dialysis, because we call it sections. The ideal way to do your dialysis is usually generally like most of our patients.
Okay.
And what is acceptable is you do it at least 3 times. At least
weekly.
3 times a week.
Okay.
And for every time you go on the machine, you sit on the machine for 3 to 4 hours, ideally 4 hours. So yeah, at least 3 times a week.
Yeah.
And you'll be on the machine for 3 to 4 hours. It depends. So like for the acute insult, what I said, it is reversible.
Yeah.
You watch the patient respond.
Mhm.
So everybody different.
Yeah.
What works for the next man may not work
Yeah,
for the
may
other
not work
person.
for
So
the other person.
we can't look at somebody with an acute insult, even though we know that the dialysis will kill your kidney.
Yeah.
The kidney can restore its function, and you go about your normal business without continuing dialysis. But we cannot look at the patient and predict, oh, when you do 3 sections, and then you don't know.
Okay.
So it is the response. So the more the person does the section, you will see the improvement. First, the symptoms.
Yeah.
If they were not urinating, they will start to urinate. If they was having a lot of water, they was swollen. You will see that the body will start, dropping. The water will start leaving the body. So then you do the lab. We need to do the lab to do the kidney function. So you'll see the kidney function, which is the creatinine, will be dropping to an acceptable level. And also we need to establish whether there is no structural damage. So that is the ultrasound. So if there is no structural damage, depending, so some people can go sometimes for 3 weeks. So 3 times a week for 3 weeks. Some can go 1 month.
Okay.
And their kidneys function restore. Yeah. We just had an experience with a 12-year-old girl that came with severe malaria.
Okay.
That she was convulsing, so the brain was involved. The kidneys too got involved.
Wow.
Because even the malaria parasite too can damage the ear. It damaged the kidney. So she was not producing urine, she was swollen and whatever. And we started her on the machine, and luckily for the relative, they were able to mobilize the resources. And that child is passing around, she's okay.
Wow.
She just came for assessment. So while in the hospital, I think she did dialysis for 3 weeks. Yeah. And her kidney function came back and it got restored.
So normal.
Wow. So
that's a testimony.
Yeah.
And that's why I said you are doing a great job at the medical center, and these are the cases that these are some of the interventions that you make on a daily basis in order to have our citizens to be well. And so we must commend you and your team at the EJS Dialysis Center there at the JFK Medical Center. So, folks, if you have been following the show, this is a reminder again that you're in tune to the program Inside JFK, and we want to announce the numbers now where you can call in to participate on the program to ask your questions. We have Dr. Dixon here that is waiting to respond to your concerns. But please be specifically to, even though she's a doctor, but she have a fee of study. So she have the place that she specialized in. So let us try to narrow down our question to this discussion so that she can be able to respond to you adequately. So do we have just get the orange number that you can call us on so that you can be live on the program? Do we have it? So, but meanwhile, you can call us on this on another number that is 0. Okay, it's our Lone Star number. Okay, that's a Lone Star number. So 080. It's on the screen there anyway. If you are following us via Facebook, yeah, on the LNTV page, you can call us on those numbers 080-514096, 080-514096 to be live on the program Inside JFK and to interact with our doctor, Dr. Dixon, who is discussing here today dialysis in kidney health. So we have a caller there. Good afternoon, caller. Your name and where you calling from? Welcome to the program Inside JFK. Good afternoon.
Yes.
Are you getting us, caller? Good afternoon.
Yeah, good afternoon.
Yeah. Please go ahead.
Yeah,
You got him? I think you were coming in a bit distorted. Can you please change your location? Good afternoon. Good afternoon, caller. Your name and where you calling from? Welcome to the program Inside JFK. Good afternoon. Good afternoon, caller.
Hello?
Yeah, good afternoon.
Yes. Well, I want to question you about the cost because I just placed a video on and I just
Uh-huh. You said a what? Oh, you mean the cost?
Falling.
Okay, your bottom is low. Hello? Okay, the cost of the okay, yeah. This talking
The
about
cause
the
of
cost.
what?
I think you're talking about the cost of the kidney damage or something. You say you just told me the cost. Okay, we got that. We got that. She will respond to you. Do we have another caller there? Okay, so Doc, I think the last caller was talking about the cost, right? He was asking what causes kidney. Yeah. Okay. Good afternoon,
Hello?
caller. Your name, where you calling from? Welcome to the program Inside JFK.
My name is Isaac calling. I also want to say thanks to the doc in studio.
Okay.
I want to know, sitting on the machine 4 hours a day and 3 days a week, does it have any side effect?
Okay. Thank you. Good afternoon, caller. Your name, where you calling from? Welcome to the program Inside JFK. Can you please move away from the noise? Hello. Hello. I think that caller, yeah, that caller is not.
Hello?
Good afternoon, caller. Your name, where you calling
How
from?
you doing?
Yeah. Welcome to the program.
Yeah, I just wanted to understand. Get to the program already in the visual no more. So, for what I gather, I wanted to ask. I have a problem, and I went to Ghana, and they told me I was going for harmonious onion and spiritual data. Yeah. So I was thinking, whether it can be done in Liberia.
Harmonious what?
Yeah, I say harmonious onion.
Oh, okay.
Onion, they move. Most often they move. When it told me about operation, and they told me also my digestive system is not functioning well. So
okay.
they told me not to eat at certain time during the course of the day.
Oh.
So I needed also operation, but they told me to go back to Ghana. So I was thinking, whether in Liberia I can be done.
Yes, of course. We have specialists at JFK Medical Center. You can come there, and then once they have done the examination, and then we can treat that year or what a surgery or so, they will tell you. Yeah. So please come at JFK Medical Center. Thank you. Do we have another caller? I think we lost that caller. Good afternoon, caller. Your name, where you calling from? Welcome to the program Inside JFK.
Good afternoon, sir.
Good afternoon.
This is a fellow.
Okay. You are low. Okay. You said what is happening to you?
In my right eye. But then those things occur when I have the time to go urinate. When I want to urinate, then I start feeling severe pain.
Severe pain in your right in the right side of your back, right?
Yeah, the right side of the
Lower back pain.
Yeah.
Okay.
That happens even at night when I'm sleeping. You know, like you're sleeping, you want to urinate, something like that. The pain in my back is too heavy.
Okay. All right.
Yeah.
Just keep following the program. That will respond to your concern. Okay. Another? Good afternoon, caller. The name where you calling from? Welcome to the program Inside JFK. Good afternoon. Are you still there? Okay. So, okay. Good afternoon, caller. Your name and where you calling from? Welcome to the program Inside JFK.
Yeah.
Come again?
What is the cause when you pee the allow people with blood?
Okay. What is the cause when you urinate and then that's the last part of the urine is blood stain, right? You have a blood stain in your urine. Okay. Thank you. Thank you. Keep following. Good afternoon, caller. The lines are boozing. Good afternoon, caller.
Yeah. This is really Howard.
Okay.
I want to find out, please. The major thing that I want to find out is to equal
Yo, you're breaking. Your line is terrible, Reverend.
Don't have even. That's funny, but we have that problem.
Yeah, Reverend. I say
Yes,
your
yes,
line.
I am.
You are coming in the stock there. That's why. Can you please repeat?
I think it's from the alarm. Everybody is coming to expect to get an alarm about. But what I'm talking about, my brother is storing off. He can hardly PP. He hardly go in the restroom and this and that. But when we go to the hospital, the people, the money they charge, our winter is about.
Okay. All right. Thank you.
All right, son.
Okay. I think yeah. Let's take that in. That can respond to the concerns. Good afternoon, caller. I think it is your line, right? Okay. Yeah. Okay. So that I think we will just come back to you so you respond to some of the concerns from the caller before we complete the
Okay, so thank you so much for the questions. So the first caller, you wanted to know the causes of kidney damage.
Yeah.
What are things that can damage the kidneys? So, like we said, again, not drinking enough water. You taking over the counter medication, especially the painkillers without prescription. You doing it frequently and in excess, so that can damage the kidney, especially the brufen, the diclofenac. Okay. And some antibiotic, for example, gentamicin that people just commonly give, they say, oh, for infection. Yeah. So taking it and not taking it the correct way, it can damage the kidney. Okay. So other infections. So whether that urinary tract infection, yeah, too much of infection, not treating your infection properly, not going for the adequate treatment. So it can also lead to kidney problem. Okay. Then we have other health conditions that when you have them, you are at risk. Your kidney is at risk. For example, high blood pressure or hypertension that is not controlled.
I think you're talking about some of the complications associated with it, right?
No.
Oh,
pressure
okay.
is a complication, and pressure can damage the kidney.
Okay.
So those with pressure. So yeah, pressure can damage it. Those with diabetes. Okay. The kidneys are at risk when people have diabetes and sugar is not well controlled. Other infections around, we're talking about malaria. Yeah. So on and off malaria, especially in the young children. Okay. Tuberculosis, TB. So most of our people get understand TB to be something in the lungs that when you can cough up blood. No, TB can damage the kidney. We have some cases, the HIV infection can damage the kidneys. Okay. Yeah. So these are just some of and they have all other inherited kidney disease. Like those ones you don't have control over. I mean, it's probably it's in the family inherited. Okay. So we got one called the polycystic kidney disease. Now another one for the men. The elderly men, prostate problem. Okay. Yeah, those ones that we've been seeing a lot in JFK. Okay. So people with prostate problems, they tend to have problem with the kidneys. Those with stones, stones are those sediments. Okay. So those who don't drink enough water, you eat food, you don't drink enough water. So like I said, the kidney need water. Water has the blood has water in its cells. So if the waste product are going to the kidney and there is not enough water to filter it through, they will settle down there and stick together and form those hard debris and turn into kidney stones. So those ones too can. So those are just some of the things that can damage the kidney. Okay. Now, with side effects of dialysis, I must think that color because it's also important. Yeah, sure. To understand.
Yeah, so we have it, even though it just
the side effect or the complications of dialysis is in twofold. Okay. Sometimes on the machine, people can develop complication, and from the line, like I said, the access. Those tube goes into the bigger blood vessels that are directly connected to the heart. Yeah. So, So from the dialysis machine itself, sometimes people pressure can drop. So hypotension.
Say automatic?
Yeah, some people can, the blood pressure can drop on the machine.
Regulate that.
So, but that's the reason why you have professionals out there. So just in case these things happen on the machine, we know what to do. Okay. Right. So blood pressure can drop. Other complication, that is with the process. So if you, like for first comer, usually when you're first going on a machine, We don't run you for 4 hours
Okay.
because we want the body to get adjusted. So usually first timer we do 2 hours.
Okay.
The next time you come in 3 hours. So it's like we gradually go
Yeah.
up to the maximum
Yeah,
hours. So
because
we
you
don't
want to
do it.
observe.
But there are times, even with that short hour, if you remove the blood too rapid, so you tend to disturb the balance, and they can have this condition called dialysis disequilibrium syndrome. So
That's a
the
big word
brain,
there.
so you take out too much of the weight such that there is no time for balance. So internally the brain swells.
Okay.
So they can have
So that's
they
another
can start
side
acting,
effect.
they can start acting confused. Sometimes they have convulsions.
Wow.
Yeah. So that's the reason these procedures are done with professionals.
Yeah.
Because we know all these complications within it. Now with the venous access, like you see the fistula, as much as the fistula is good, it's permanent, it remains there once they do that surgery, but it has so sometimes infection. Our skin.
Yeah.
Our skin has a lot of bacteria living with without causing problem. So the skin is the first barrier of protection. Okay. So you have this connection. So if the procedure going into your vein or to your line is not done in a sterile environment, it might introduce infection. So you can get infected. Sometimes blood can clot. The blood can clot. And sometimes the blood vessels that they do the surgery on, it gets weak. Okay. And we call it aneurysm. So those are all complications. Then from the line, the catheter, what I say they can put in the neck, they are predisposed to sometimes, especially the ones that goes in the thigh, through the thigh to the femoral. Okay. They are prone to developing infections. Okay. So infection is one. So those are just some of the complications of dialysis. And other side effect too. Putting somebody on the machine, their body is not adjusted, you taking the blood or taking the water out. Sometimes they have nausea, vomiting. So those are just minor side effects. Okay. So those are some of the side effects or complications when it comes to dialysis. The fellow with the hernia, like Mr. Creighton, you rightly said, I am not a surgeon. So hernia means something is bulging through or defect. Yes. So I don't know what I didn't get it clear whether it's a hiatus. I think it's hiatus hernia that has to do with the stomach pushing through a defect or something. System or something. So usually there's an opening between the chest wall and the stomach. So some of the hernia, the stomach tend to bulge in the chest and they can have persistent vomiting. Okay. But we have specialists now. We have surgeons there.
So if you are listening, you can come at the GFK Medical Center after assessment.
Let a specialist see him and tell him what are the options available. It is if it cannot be done in Liberia, then obviously you can go. The caller mentioned the right back pain. Lower back urination. Like I said, flank, we call it flank. So back pain, especially on the side, sometimes the pain is burning. Those are signs of kidney disease. Okay. So you need to go for checkup. And if you say you're feeling pain with urination, that's a sign of infection. So you need to go get yourself checked so you can know whether it is not it's not something of concern. Okay. Another caller mentioned urinating blood. We call it terminal hematuria. So you start urinating, then at the end of the urination, so usually you tend to look for a problem like prostate problem, bladder cancer. Okay. So stones, those things can cause the blood. You see visible blood, okay. Especially for the men, the prostate. That can happen. Okay, then somebody mentioned that his brother has been going and swelling up and not urinating, but his concern, it has to do with the money. So sorry sir, I can't help you there. I can't speak to that. So that is for the administrator.
There are a lot of cases where people come at the medical center.
Once you have been there and they told you it has reached your money point, I sure they have given you the diagnosis of your patient and probably the way forward. So certainly.
Okay, thank you, Doc, for responding to the concerns of the callers, and we will. Can we take okay? So we can take any more calls now. We just conclude the discussion, and So Doc, so how long can people with diseases, live with they are on the dialysis now? How long can they live? What is their lifespan expenditure?
Okay, life. So people, like we said, dialysis improve the quality of life for patients who have kidney problems. Now, there are other things that factor in. You cannot predict, but on an average, 5 to 10 years. But other things factor in. For example, whether this person has other underlying conditions, for example, pressure, diabetes, HIV, and other autoimmune conditions. So comorbidities, that means you having other underlying condition and you have your kidney problem. So that factors in. The age, usually the elderly people, so age too is a factor as compared to somebody who is younger. And another thing I factor into is the dialysis frequency. So if you're doing the dialysis the correct way, then you have a chance. So if all those things are factored in correctly, some people live 20 to 30 years on dialysis.
All right. So Doc, we are out of time now, but we would just want you to, in your parting comments, you can just tell the public what are some of the food and things that they can eat, because I guess you have some food that you can eat in order to not, for your kidney not to damage and all of that.
Okay. So usually we talk about dialysis connected to kidney disease. So most of the thing in the diet. So if you read a textbook, you'll see most of the diet connected to the whiteboard, but we try to come to our own context. What is on the market and what. So the rule of thumb is usually salt. Because the more you take in salt, the more your body will hold on to water. So excess salt intake can promote swelling of the body. So you need to reduce. So we say don't take it at all. So reduce it.
Like some people when they are eating food, they put raw salt and all of that.
So reduce the salt intake. And there are other electrolytes we consider like potassium. And some of the food on the market, they have high potassium content. So you need to reduce the food. We're not saying don't eat it at all, because in people who have kidney disease, technically, they are immunocompromised. In that the immune system can fight for the, it's no longer able to fight. So small infection going to knock them down. So they need to eat nutritional. So for example, protein, food high in protein. For example, you find it in chicken. So chicken has a lot of protein. So that will be encouraged.
You can eat that.
So even the vegetables, because they need mineral, but like I said, some of the fruits they are high in potassium. So for example, avocado, we can call it butter. Technically speaking, how many person can afford to eat? So sometimes we got to be practical. You can say, coming back to protein, egg. Egg has high protein, so they need high protein diet. Vegetables and fruits.
Thank you so much. So folks in Maryland, this is how we will like to come to an end of today's edition of the program Inside JFK. Today we had Dr. Flenway Dixon, an internist from the internal medicine department at the JFK Medical Center. But she's there working with a team, along with a team at the EJS Dialysis Center, the newly dedicated by the governor of Liberia, and they are there providing services to Liberians. She just mentioned a case involving a 12 years old. That's another testimony that we can say here that at least she came with this problem or the kidney disease, and now she's well and strong. And so thanks to the team there. And so for today's edition of the program Inside JFK, I've been your host, James Bill Curtin is my name, from the communication department at the JFK Medical Center. And today we were discussing dialysis and kidney management or kidney health. Thank you very much. Do join us next Monday for another edition of the program. Thank you.